Here's a basic tutorial on how to apply a bandage for a broken wrist or hand. Prepare or wash your hands thoroughly with soap and water to minimize the risk of infection. If available, put on disposable gloves. Before applying a bandage, make sure the broken wrist or hand is in the proper position. It should be immobilized in a way that's comfortable but provides support. Begin by securing the elastic bandage at the base of the fingers or hand, just above the wrist. Make sure it's snug but not too tight, as excessive pressure can cause further damage or restrict blood flow. Continue wrapping the bandage diagonally across the palm, then up and around the wrist. Make sure each layer overlaps the previous one by about half the width of the bandage. This provides support and compression to the injured area. Once you've reached the desired coverage and support, use adhesive tape or bandage clips to secure the end of the bandage in place. Make sure it's not too tight, as you want to avoid cutting off circulation. After applying the bandage, check the person's fingers or any sign of reduced circulation, such as numbness, tingling, or bluish discoloration. If you notice any of these signs, loosen the bandage immediately. If possible, elevate the injured wrist or hand above the heart level to help reduce swelling. Remember that a bandage is a temporary measure. It is crucial to seek professional medical care to assess the injury properly, confirm the diagnosis, and provide appropriate treatment. Here's a basic tutorial on how to apply a bandage for twisted ankle. Evaluate the severity of the twisted ankle. If there is a significant swelling, bruising, or deformity, or if you suspect a fracture, it is essential to seek immediate medical attention. For mild to moderate sprains or twists, you can proceed with bandaging. Apply padding. This is optional if available. You can apply a layer of foam padding or gauze around the ankle to provide extra cushioning and support. This can help reduce pressure and friction under the bandage. Begin wrapping. Start at the ball of the foot and wrap the elastic bandage around the back of the ankle. Ensure that the bandage is snug but not too tight, as excessive pressure can worsen swelling and impede circulation. Continue wrapping the bandage diagonally across the top of the foot and around the ankle, moving upward. Make each wrap slightly overlapping the previous one. Keep the tension even to provide support without cutting off circulation. Cover the ankle completely. Continue wrapping until you've covered the entire ankle area, including the heel and the Achilles tendon. Make sure you go several inches above the ankle joint to provide adequate support. Secure the end. Use adhesive tape or bandage clips to secure the end of the elastic bandage. Make sure it is firmly in place but not too tight. Check the circulation. After applying the bandage, monitor the toes and foot for any signs of reduced circulations, such as numbness, tingling, or bluish discoloration. If you notice any of these signs, loosen the bandage slightly. Allow the injured ankle to rest and apply ice for 15 to 20 minutes at a time, with breaks in between to reduce swelling. Even for mild to moderate ankle sprains, it is advisable to consult a healthcare provider for a proper evaluation and treatment plan. They may recommend physical therapy, an ankle brace, or other intervention to aid the healing process. Here's a basic tutorial on how to apply a simple bandage for a minor cut on your hand. Start by washing your hands thoroughly with soap and water. If you have disposable gloves, consider using them to maintain cleanliness. If the cut is bleeding, apply gentle pressure with a clean cloth or sterile gauze pad to stop the bleeding. Elevating your hand above heart level can also help reduce blood flow through the area. If the cut is dirty or contaminated, clean it gently with mild soap and water or an antiseptic wipe. Avoid scrubbing the wound as it may cause more damage. Rinse it thoroughly and pat it dry with a clean, sterile cloth. You can apply an antiseptic ointment or solution to the wound to help prevent infection. Place a sterile gauze pad or adhesive bandage strip over the cut. Make sure it completely covers the wound and extend beyond the edges to ensure proper protection. Use adhesive bandage strip or sterile adhesive tape to secure the gauze pad or bandage in place. Be sure not to wrap it too tightly. You want it to snug but not too constricting. After applying the bandage, monitor your hand for any signs of reduced circulation such as numbness, tingling, or bluish discoloration. If you notice this sign, loosen the bandage slightly. Depending on the severity of the cut and your healthcare provider's recommendation, you may need to change the bandage to clean the wound regularly. Keep an eye on the wound for any signs of infection such as increased redness, swelling, warmth, pus, or a fever. If any of these symptoms occur, seek medical attention promptly. Even for minor cuts, if there's any concern about the wound's depth, possible foreign objects, or infection, consult with a proper healthcare provider.